This should make your breast cancer journey just a little bit easier because you already have a ton of appointments. There's a lot of information coming at you. And if we can make your journey just that much easier, it's worth it. So, get a pen, get a paper, and jot these things down because I think it'll be helpful. Hi, my name is Sherry from Twin Sisters Mastectomy Boutique. And when you have been diagnosed with breast cancer and you're going to have surgery for your lumpectomy or your full mastectomy, a lumpectomy is a partial breast being removed, a mastectomy is a full breast being removed, you want to find a certified mastectomy fitter. So you can check with your hospital if they have a list, you can Google online, you can call the Cancer Association near you, and hopefully you can maybe even ask friends or somebody else who's been through it, but you should be able to find a place. And it's important that they're certified because I'll speak for Canada, where I am. If you're not certified, if you're just kind of buying online or something, you won't be eligible for the government grants. And I fill out the government grants for you. And in Canada, you automatically get a government grant for your breast prosthesis. And if you don't get a grant, which everybody's entitled to, as long as you have a health card, then your private insurance won't kick in. So it's really important that you get a government grant for your breast prosthesis if you're going to be using insurance, but go to a certified mastectomy boutique because they're going to know how all this stuff works. Then you also want to try to get to that certified mastectomy fitter 1 or 2 weeks before your surgery. Not a month ahead of time necessarily, although that can happen, not the day before, because you want to be fit with your post-op bras, okay? So these are really, really important because they help to stabilize tissue in the surgical area. And while you're there, you want to be able to tell the fitter whether you're having reconstruction or not, because that is a completely different kind of post-mastectomy garment. This is post-mastectomy with no reconstruction, and this is post-mastectomy with reconstruction. And you'll have to ask your healthcare team if you don't already know, right? If they haven't told you if you need a compression garment or not, ask them. Don't just ask them, don't just say you're having reconstruction, but say to your healthcare team, do I need a compression garment? So, so important because they're treated post-op very, very differently. And another reason to go to a certified fitter is these have to be fit on you. Like, it's very important to get the right fit. And for something like a compression garment, you're going to think it's too small, but it's not, because you have to like squeeze it together and do it up. It's hard because it's like a girdle for your upper body. And because of that, you need to have somebody who knows how to fit. Same with this, you need somebody who knows how to fit. So, the first rule is go to a certified fitter. So, okay, so now why is that time frame important? So you don't want to wait to the very last second. I always get people who call me and go, I'm going into surgery tomorrow, or, they'll call me on a Friday and say, I'm going into surgery Monday. I need a garment, post-op garment to take with me to the hospital to wear home from surgery. That's often not enough time. So if you give yourself like a week or two, then you've pre-planned it. If they don't have something in your size wherever you are, they have time to order it and get it in, and then you're not panicking. And the reason I said don't go like a month beforehand, although I don't think it's a terrible idea. I get a lot of people who come in a month ahead of time, but I have had people tell me that they've been put on medications or the stress of the surgery, and they've put on so much weight that the post-op garment doesn't fit them anymore. It's tight and it's uncomfortable. So that 1 or 2 weeks is probably ideal. Just saying. And then you want to know when to come back for your breast prosthesis and your mastectomy bras. And you should probably wait 4 to 6 weeks, because then your body not only is healed on the outside, but you've got enough healing on the inside. And sometimes people will say to me, well, I'm fine, I'm healed. After 2 weeks, yeah, but the inside of your body still needs to heal, because breast prosthesis can have some weight to them. And we don't want to stress out your body. So the minimum is 4 weeks, and 4 to 6 weeks is fine. You don't want to wait a year, really, because then your body has biomechanical imbalance, meaning that there's weight on one side and not the other. But you do want to wait to make sure everything's healed, there's no seepage or leaking, and all of that is healed up properly. I get a lot of people who are enthusiastic and they're like, 4 weeks, I'm coming in, and then they have leakage and seep, and I'm sorry, but you can't be trying things on like that. You're not properly healed, and we want to make sure that you have the best outcome, so you need to be properly healed. So, that 4 to 6 weeks is really, really important. And then when you come in, this is optional, but I would suggest you bring your favorite shirt that you love to wear. And then you can try it on with the mastectomy bras and with your breast prosthesis and just see how it looks, right? Because sometimes people have like a very low V-neck is their favorite shirt, and you might find that the mastectomy bras that you buy, if you didn't have the shirt, wouldn't work with that. So, we'll get the mastectomy bras that work with your clothing. Most of the time, you can wear any bra with any outfit, but if you have something particularly low cut or something, I don't know, it's nice to know that you have a bra specifically that you can wear with that outfit and others. So a good example is if you have like a very low V-neck and the mastectomy bra shows, like here's my bra showing right now, well, maybe we get you a bra that has lace that comes up here so that your bra doesn't show. Does that make sense? There you go. And if you don't want to bring in your own shirt, that's fine. Maybe you don't have a favorite shirt. Maybe you love them all. It's okay. I always have a tight white t-shirt in my fitting room for you to try. And why do I have a tight white t-shirt? Because this one has a bit of lycra in it. This is great because white shows everything, and it's a tight enough t-shirt that you can see if the girls look even. If you have a baggy t-shirt, it's hard to tell. But if you have something a little bit more fitted, and people will say to me, I never wear t-shirts that tight. That's okay. You're not wearing it out. You're just wearing it in my fitting room. So that's fine. Totally fine. And then once we fit you with the right breast prosthesis and some, bras, we get an idea of what you like. The best part is you get to pick out stunning bras. Look how gorgeous that is. And you can get bras that are as simple or as fancy as you like. And in fact, I have a ton of women who come in here who haven't had a mastectomy, but they just really like the bras. They like the fit. They like the way I fit them. They just have never been able to get a comfortable bra before. I get that all the time where people will bring in their friends and they'll be like, I've had a mastectomy, my friend hasn't, but she can't get a bra that fits properly. And then I fit her and she's like, oh my gosh, this is fantastic. So those are the steps. And my job is not only to fit you with your breast prosthesis and your post-op garments and your mastectomy bras and swimwear and what have you, but my job is to make this part of the journey so much easier. And I can't tell you how many people will say to me, it doesn't feel like a medical appointment. It feels like I'm visiting a friend. I love coming here. That is like the best thing you could tell me. And honestly, I meet the nicest people here. People are often nervous the first time and they don't know what to expect, and that's okay. Wherever you are in the world, go to a place that makes you feel comfortable, because this is an important and very personal appointment. And whoever you're working with to fit you with your prosthesis and your mastectomy bras should be making you feel happy that you're there and happy that you're having this shopping experience that just happens to restore your silhouette. So let me know in the comments down below if you've had very good fitting experiences. I've heard about a couple of really great fitting experiences. And let me know what the biggest surprise was. Was it that the bras were so stunning? Was it that the breast prosthesis were literally off the shelf? Because these are off the shelf. We have them all in stock and we just pull them down. We do offer custom made breast prosthesis for people, but seriously, Very few people go for that option, but it is an option. But these are all pre-made, prefabricated in different shapes, different sizes, different skin tones, and we can just pull these out, whether it's a full prosthesis or a partial, and we can just pull them off the shelf and fit you with the right one, the one that's right for you. So was that your biggest surprise, that they were all prefabricated, or that the bras were so stunning, or that in many, many cases you can leave within an hour with your new breast prosthesis and your new bras? Because most of us, I'll speak for myself anyway, we have everything in stock. A lot of people will say to me like, oh, when will it be ready? Is it going to be like a week, a month? How long? And I'm like, how about in 45 minutes? And they're like so happy and beaming. So let me know in the comments down below. Don't forget to like and subscribe, and we'll see you soon.